Good morning, everyone, and welcome back to the Fox 29 Morning News. Hope you're having a great start to your day. Time now to check out the Fox 29 Med Report. Do you believe that 10 million Americans suffer from degenerative spine fractures and bone loss caused by osteoporosis? Well, Dr. Charles Theofilos joins us right now, and Dr. Theofilos has offices in Palm Beach Gardens and also Lantana. He's a neurosurgeon to talk about some new and innovative procedures that you guys are doing to kind of offset some of these spine fractures and also the bone loss. Tell us what's going on right now in your field.
Well, right now, osteoporosis, as you know, affects the spine. Over 700,000 patients a year have spine fractures associated from bone loss from aging. We need to figure out a better way to treat it. In the past, we just put them in braces and put them in the bed and say, hopefully you'll get better. You know, take pain medication, hopefully those fractures will heal up. Or you have to perform some large spine operation with instrumentation. Most recently, what they've developed is a new technique of placing a balloon into the bone. And what happens is the bone collapses because you lose strength in it. And it's called a compression fracture. And when that happens, the spine becomes bent. The more compression fractures you get, the more height you lose, you become shorter. The spine humps over and you develop what's called a hump, a spinal hump. You start losing the ability to breathe because your lungs become blocked off, and you have a decreased appetite because your abdomen's compressed. So we got to figure out a better way to treat this. Kyphoplasty is a new innovation in treating compression fractures due to bone loss. We place a probe into the vertebral body, the bone that's collapsed, and we inject and inflate a balloon. This balloon restores the height of the bone, and it hopefully gets it back to what it was beforehand, so you're not losing that height. Once the balloon has expanded, we fill it with cement.
And what I know some of the patients like about it is that it is minimally invasive. We actually have some pictures right now of someone getting the procedure. Tell us about what we're seeing right now on the video.
Well, right now, they're inserting, the tamp is actually into the bone, and they're inflating the balloon to certain pressures. And with the balloon being encapsulated, you can inflate it at higher pressures, and it pushes the bone and expands it to try to get it back to the height it was before it collapsed.
And bottom line, how will this affect people in a positive way in their quality of life?
Well, hopefully the pain will be eliminated a lot quicker. It's minimally invasive. You go home the same day, and you don't have to wear a brace. You walk out of the hospital and hopefully pain-free. We can't reverse osteoporosis by this procedure, but hopefully we can treat some of the spiraling effects of compression fractures down the road by losing height and causing pulmonary problems down the road.
All right. It's a difficult procedure to talk about in just 3 minutes, but we appreciate you giving us some insight in this new innovation right now. And once again, you have offices in Lantana and Palm Beach Gardens. Thank you very much.
Thank you.
Dr. Charles Theofilos joining us on the Fox 29 Morning News Med Report. We're back in a couple minutes with more weather and traffic on the quarter hour.
Now have a new way to help people who are suffering from a pinched nerve in their backs. The procedure is called microdiscectomy, a big word, but the surgery involves only a tiny incision. I found out from one doctor it means a quicker recovery for you. Here's more. Believe it or not, Morris Schlomowitz just had extensive back surgery a few weeks ago.
I was having pain down my left leg, shooting down from the back down to the foot.
But thanks to a new type of microsurgery, Schlomowitz skipped a long and painful recovery and went home the very same day.
I was looking for something that was very non-invasive, or as most non-invasive as possible, and also that would allow me to get back to work and to play tennis as soon as possible.
Schlomowitz got something called a microendoscopic discectomy, or MED for short. Surgeons use tiny instruments and a TV camera to guide them into the back and remove nerves pinching ruptured discs. Dr. Charles Theofilos says thanks to a small incision, patients are back at work in about 2 days.
At that time, we can remove what's causing the patient's pain. Then we pull out the cannula, put a few stitches in, and essentially a Band-Aid over their back, and they go home the same day.
And because the MED procedure does not traumatize or strip the muscle near the back, patients have quicker recovery times.
And that's probably the biggest difference between this procedure and the other procedure. Stripping the muscle off the bone hurts.
But whatever the reason, Morris Schlamowitz knows one thing. Thanks to MED, his pain is a thing of the past. Traditional surgery means recovery time in about 4 to 6 weeks. And remember, with MED, you do have a choice, your choice of anesthetic.
Patients that have back pain and leg pain are candidates for the MED if they have herniated discs or spinal stenosis in which the disc or the bone is pushing on the nerves as they leave the spine. These patients, we usually enroll in the physical therapy before surgery to see if it can help relieve their pain. Other options include steroid injections, medication to help reduce the inflammation, and the test of time to see if people can get better on their own. For those patients who have a rapidly changing neurologic status, that is, progressive weakness or numbness or reflex changes, or fail the conservative measures, then at that point they may be candidate for surgical intervention such as the MED procedure.
A frequent cause of back pain is a ruptured or herniated disc. When a disc herniates, one or more of the spinal nerves becomes compressed. This translates into pain, which spreads throughout the hips and into the legs. Surgery is often the only option. Traditional surgery requires the muscles of the back to be cut in order to expose the affected area and make repairs. However, this surgery often involves a multi-night stay, followed by weeks of painful post-operative recovery for the patient. A new procedure may eliminate much of this. The new procedure, called the MED, microendoscopic disectomy system, allows the surgeon to access the affected area by gently dilating the muscle to establish a pathway. This process limits incision size and the disruption of fragile muscles that cause postoperative pain. A revolutionary optical technology called an endoscope is used to visualize the surgical site on a video monitor. Specialized surgical instruments are then used to remove the herniation and decompress the nerve. When the endoscope is removed, a bandage is applied to close the tiny incision. The patient is often sent home the same day and can return to work in as little as 2 days. If you or someone you know suffers from this problem, be sure to ask your doctor about this new method of treatment for disc herniation.
I was the first physician to perform the MED in South Florida. This was done at JFK Medical Center. Since then, we have done numerous patients with the MED with wonderful successes. The important difference between the MED and regular disc surgery is that with the MED, we travel between the muscle fibers to the spine. In traditional back surgery, we have to split the muscles and strip them off the bone, which is a very painful procedure and requires many months of healing on the muscle's part. As we can see with this diagram, we are operating through a scope with a camera in it on the spine, removing herniated disc material, which is compressing the nerve roots, causing pain in the back and down the arm or leg. This allows for faster recovery and a much less painful recovery because now the muscles do not have to reattach to the bone as they do in traditional back surgery. They just naturally collapse back together again. With the MED, patients normally leave the hospital the same day. With traditional back surgery, they can be in the hospital for up to 1 or 2 days. With the MED, patients can be enrolled in physical therapy the first week after surgery, versus traditional back surgery, which requires about 3 to 4 weeks of healing of the muscle back to the bone before we can initiate into physical therapy. The MED procedure is a better procedure in my opinion.
Advances in modern surgical methods make it possible for you to be in and out of the hospital these days in almost no time. Sometimes a surgeon can actually perform these procedures on an outpatient basis. Quite a change from just a few years ago. We're joined today by Dr. Charles Theofilos, a local neurosurgeon who's here today to tell us about the latest surgical techniques. Welcome back.
Thank you.
We say the latest surgical techniques because last March, I believe, you were the first one in this area to do the, what's it called, the MED, the microdiscectomy?
Microendoscopic disc surgery.
It's a bigger word.
MED is very simple.
Right. All right, tell us a little bit about that, and we've also got some video to accompany this.
MED is a wonderful procedure that we can utilize to operate on patients' low back for herniated discs and some forms of spinal stenosis. It utilizes an endoscope, and through a small incision, we can go in there and remove a herniated disc. It's less invasive. It costs less for the patient's insurance company, the patient, and the hospital. Patients go home the same day versus the almost 2 days in the national average for a regular micro disc surgery.
Sounds like a win-win situation.
It's a win-win situation. A recent study has shown that 100% of these patients said that they'd have surgery over again.
Wow.
That's remarkable.
That is. No doubt about it then. And you're training doctors across the U.S. in this?
I am a national teacher, coordinator for the MED, as well as the BAK fusion systems.
Let's talk a little bit about that. There's a couple of screws in the middle there.
This is the BAK fusions for the spine, and it is also a wonderful advancement. What they've done is patients with severe degenerative disc disease, chronic disabling back pain, that in the past we really didn't have that much treatment options for. Now we can go in there and remove the degenerated disc, and fuse the one vertebrae to another vertebrae, and this is where our spinal sac runs. And what happens is, in severe degenerative disc disease, the bone rubs on the bone, causing severe back pain.
So that lifts it and gives you that extra room?
We remove the disc, jack up the inner space between the bones, put these titanium cylinders in, and then fill them with bone.
And that lasts forever?
That lasts forever.
That's
one bone heals to the other bone, and then you don't have bone rubbing on bone.
Okay, and then one thing that you want to talk about is the stealth technology. That's like the latest thing?
Stealth technology is wonderful. It is the newest surgical navigation system.
Yeah, just hold it there. They'll pick it up.
What this is what we do is we put a patient's CAT scan into a computer, very powerful computer, and we can perform a 3D reconstruction of a person's brain or spine. And here you can see the ear, the head, and then actually inside the brain you can see a tumor. And anytime during surgery we can place this magical wand in the patient's head and know exactly where we are. As we can see the wand here pointing to the tumor. We know if we're to the right of the tumor or to the left, and it can help us plan our desired path along very critical anatomy.
A lot less invasive than exploratory.
Much less invasive, and it takes the exploratory out of brain and spine surgery. This is another example which shows, illustration which shows the wand moving to the patient's spine during surgery with a 3D image.
Oh, that's fantastic. All right, we've got to go, but thank you a lot for sharing that with us. Neurosurgeon Dr. Charles Theofilos practices here in West Palm Beach, so if you're considering surgery, you might want to get in touch with him. Thanks a lot.
Thank you.
I went backpacking 8 of 9 weekends in a row.
And I can do a lot of the things that I couldn't do before, like bending and lifting and bowling, and now I walk about 2 miles a day.
I could do a lot of things. I could go up to Disney and walk in the parks all day long, which I couldn't do before. I don't have to rent a wheelchair like I used to. I could do some sports. I could go to work and do a lot of different things.
Want to see how I survived?
That would... Oh, my
This is how I survived.
Living without back pain, a modern surgical approach, a special program to help patients suffering from chronic back pain. Hello, I'm John Early, your host for this program. It's hard to believe, but 90% of us will seek treatment for back pain at some point in our lives. That's right, 90%. Back pain is the second leading cause of doctor visits and the #1 healthcare expense in the U.S. today. So if you suffer from back pain, you're certainly not alone. This program is for chronic back pain sufferers, people that are not responding to traditional forms of therapy such as physical therapy and prescriptions. It's a life filled with chronic pain that has gone on for 6 months or more, if not years. Tom, what was your life like with back pain?
It was pretty bad. I couldn't do a lot of the chores. I couldn't do a lot of the sports. I was in pain all the time, and my legs used to fall asleep on me, and I used to, as I walked, used to stumble and trip and fall.
Prior to my operation, I was stiff. I couldn't play with the kids and, do a lot of things. My left leg was numb. I drive truck for a living, so I couldn't shift.
I started having some real severe low back problems with pain into my legs, severe to the point where I sometimes couldn't work, couldn't do a lot of the things. Got into a physical therapy program that helped a lot and got me back into doing a lot of things, but as time went on, the physical therapy was less effective.
I didn't really have much of a life with my back pain. I had nothing but devastating, horrible, tremendous pain constantly, 24 hours around the clock, no matter how much medicine, no matter what we've tried. I lived on the couch. I went to the couch, to the bed, to having assistance to even help be bathed and to even eat. I mainly was bedridden. I was eating even in bed. There was no life. I just laid and cried and just was waiting to be fixed.
If this sounds familiar, keep watching. We'll share with you the most common cause of serious back pain and explain how it happens. Then we'll introduce you to a modern surgical technique called interbody fusion. Cases using the well-established BAK implant have changed the lives of people that have had traditional treatments fail. We're told there was nothing that could be done or even had a failed surgery using another technique. Finally, we'll spend some time with Dr. Charles Theofilos at JFK Medical Center in Atlantis, Florida. He is a renowned spokesman and clinical expert in this modern approach. Let's continue our program by explaining the most common cause of back pain, a degenerative disc. Listen to our clinical spokesman as he explains why most backs hurt.
Normal healthy discs, such as the one shown here, act as the shock absorbers and spacers of your spine, allowing you to bend and move easily. However, as discs degenerate, they weaken, tear, and become dehydrated. The result is a loss of the shock absorption properties of the disc, narrowing of the nerve openings of the sides of the spine, and a pinching of the nerves, all or any of which may be the cause of your back and leg pain or numbness.
Now you know why back pain is so common. A life of heavy lifting, strenuous sports, driving, and even sitting for long hours can bring about chronic back pain. You know your back hurts and conventional therapy isn't working. Now what? How did your doctor introduce you to the BAK cage?
My doctor didn't really introduce me to the VA cage. I kind of found him on a local TV news channel. I came home from after the hospital from doing a myelogram, and as I was laying there,